listening to Chief's Rounds on Sirius XM Doctor Radio.
Well, welcome back to Chief's Rounds. I'm Dr. Mark Pochapin, your host. I'm the Division Director of Gastroenterology and Hepatology, Vice Chair of Clinical Affairs for the Department of Medicine here at NYU Langone Health. I'm broadcasting live from the heart of Manhattan at Tisch Hospital. We are in the lobby. If you ever pass by when you're coming for your doctor's visit, please wave. We love seeing all of our fans not only listening to us, but also being engaged with their own health. This is a station that allows you to learn information to empower you to take care of yourself and the people you care about. It's so important to have the knowledge that when you go to a doctor, you're able to have a discussion, so at least you understand what it is that you're talking about, particularly with the fear that is so prevalent when taking care of our own selves when we're diagnosed with a certain condition, especially when we don't have the information at hand. And what's beautiful about this station is that we're able to give you the information to empower yourselves. And I am so excited for this next hour because we have a real superstar guest. Meena, are you with us on the air?
I am here.
Okay, Dr. Meena Seshamani. Dr. Seshamani is the Deputy Administrator and Director of the Center for Medicare. She is the top person in Medicare. What I like to make everybody understand, because we're going to open the mics for questions, that she is not a politician. She is a doctor. She is a head and neck doctor, and we're going to talk about her background, her expertise. But it's open enrollment season for Medicare. And a lot of people have a lot of questions and a lot of confusion. And Medicare is quite important, quite prevalent, and people don't recognize the different programs in Medicare with the different letters, what Medicare Advantage is, and that's why we're here. And I'm honestly just so honored to welcome back Dr. Meena Seshamani. As the Deputy Administrator and Director of the Center for Medicare, she's taking her time out. And believe me, she is busy. This is her busy season. And she's here really to help all of you understand what really happens with Medicare, what the programs are that you need to know about, and also what's the best program for you and what's being done in Medicare to help us with so many of the costs of medical care. And one of them that keeps rising is the cost of prescriptions. And there's a lot of good news out there. What's amazing is how many people are actually enrolled in Medicare coverage. In April of 2024, approximately 67.3 million United States adults are enrolled in Medicare. That's quite a number of people, Meena, that you're responsible for. And again, I'm just so honored to have you on the radio. And for people listening, this is an open show. We are live. And if you have questions about Medicare, give us a call at 1-877-NYU-DOCS. That's 1-877-698-3627. I want to remind everybody that Dr. Seshamani is a physician, not a politician. She has the ability to answer questions. She oversees Medicare, but she doesn't make the decisions about how Medicare runs, but she makes sure it runs in its best interest for you. And there are new programs that she's going to tell us about that I think you're going to be excited to know that maybe you don't know about. So, Meena, thank you so much for joining. Tell us a little bit about your background, how you got involved in Medicare from being an ENT surgeon, and what's in store for people listening in terms of enrollment and some of the benefits of coverage.
Sure. Well, it's so great to be here with you, Mark, and with all of you who are listening. And as Dr. Pochapin said, this is a very important time for everyone in the Medicare program, the 67 million of you out there, because this is Medicare Open Enrollment. It goes until December 7th. And why is Medicare Open Enrollment so important? It is the chance that you have each year to figure out if you are in the Medicare option that works best for you. And there are some really big changes that have happened with the Medicare program, some really big improvements that make it even more important than prior years to go and make sure that, for example, your prescription drugs that you take are covered by the prescription drug plan that you are enrolled in, that the doctors that you want to see, if you are in Medicare Advantage, that the doctors that you want to see are in the plan's network. And so it's a really, really important time. So some of the incredible improvements to the Medicare program. First, starting January 1st, 2025, for the first time ever, in the history of the Medicare program, there will be a $2,000 limit on what you spend out of pocket for your covered prescription drugs. And, Dr. Pochapin, you had asked about my background. So I am an ear, nose, and throat physician. I was seeing patients up until I took this job in Medicare. And I had a woman on Medicare where we would get on our smartphones and look at GoodRx to try to figure out what medicine I could prescribe her that she could afford. So it is huge that now there will be a limit to what people pay out of pocket. And importantly, it's only for covered prescription drugs. So that's why right now it is so important to go and check and make sure that your prescription drugs are covered by your plan. So that's
This
like
is
one of the big changes.
so critically important. And I want to just remind if your listeners that who we're talking to, Dr. Seshamani, is the deputy administrator. This is the top person for the Center for Medicare. She oversees all of Medicare. And what she's saying is so important. And the reason I think you took your time out to spend with us is because this coverage for prescription plans is huge. All we hear about is bad news, bad news, bad news. This is amazing news to have a cap in the expense of our medications, because there are medications where one tablet can cost over $2,000. And it's
Absolutely
unbelievable that Medicare is covering this. This is such a relief, not only for patients, but for doctors. You mentioned as an ENT doctor that you would have to be concerned about what you prescribe for your patients because of the cost. This happens all the time. And for people listening, this is a huge asset for those people who are eligible for Medicare to be able to have the prescription costs covered. And if you have questions for Dr. Seshamani, she's here to talk to you. She wants to answer questions. Again, reminding you she is a physician overseeing Medicare, not a politician. We do not want political questions. We want brass tacks about how we actually get the coverage that we need. Give us a call. We're at 1-877-NYU-DOCS. That's 1-877-698-3627. This is your opportunity to speak to the top person in Medicare. And not many people get that opportunity. So give us a call. So, Meena, let me just ask you a little bit about some of the differences. I think a lot of people are actually confused of what Medicare is, what Medicare Advantage is, what's Part A, Part D. Can you just give us kind of an overview and who's eligible for Medicare?
Sure. So let's start with who's eligible for Medicare. It is anyone in this country who is age 65 or older, certain people with disabilities, and people with end-stage renal disease. Those are the people who are eligible for Medicare. There are two main ways in which you can get Medicare. The first is traditional Medicare. That is the traditional program run by the government where you can see anybody in the country who participates in the Medicare program. And 98% of healthcare providers in the United States participate in the Medicare program. So with traditional Medicare, you can see anybody you want. There is no network because it is run by the government. Then there is Medicare Advantage, where Medicare pays private health plans to administer the Medicare program to people with Medicare. One of the big differences between Medicare Advantage and traditional Medicare is that in Medicare Advantage, you then have to see the doctors that are in that plan's network, because the private health plan will contract with doctors to be able to see you. So it's very important, if you're choosing Medicare Advantage, that you make sure that the doctors that you want to see are in the plan's network. Another big difference between Medicare Advantage and traditional Medicare is that they can offer some additional benefits, like some dental coverage, hearing coverage, vision. Here too, it's important that you read the fine print and understand what is being provided by the plans so that you don't get surprised. So traditional Medicare and Medicare Advantage, they cover, hospitalizations, physician visits, things like that. Then you have Part D, which is the prescription drug program for Medicare. And that's where there have been really significant improvements this year. As we mentioned, that $2,000 out-of-pocket cap. Another big change that already happened that I hope many of you are taking advantage of is that recommended vaccines are available at no cost. So for those of you who before had sticker shock of shingles costing you $200 or $300, now it is $0. So go get your shingles vaccine, your RSV, COVID, all of your flu, all of your vaccines, because all those recommended vaccines don't cost you any money now.
It's
And
such
another
great
big
news.
change.
Go
Mm-hmm.
ahead. I'm sorry. Yeah,
No,
it's just such
and
great
one
news. We just had a show about the devastation that shingles can cause, both on the eye and the skin and the pain syndromes, and that the vaccine is incredibly effective, and it's recommended for people over the age of 50. And if you're Medicare, you should be getting that vaccine because you're over the age of 50, and it's covered. And that's what is so great about it.
Exactly, exactly. And the other big improvement that people should know about is that there is starting January going to be a prescription payment plan. So, Mark, as you mentioned, sometimes people go to the pharmacy and they have a copay like $600. They don't necessarily have $600 available to be able to pay in, one lump sum. So now there is a payment plan where you can spread the cost of your prescription drugs out over the calendar year. So if you have high prescription drug costs, particularly in the first 3 quarters of the year until September, you could benefit from enrolling in the Medicare prescription payment plan. And you enroll in that with your health plan, with your drug plan. So when you enroll in your drug plan, you can also call them and figure out if you would benefit from the payment plan and you can enroll in it. And I say that because if you have most of your prescription drug costs in the end of the year, then spreading them out may not make sense because there's really nowhere to spread them out to. If you accumulate your costs in November, there's only one more month left in the year. So that's why it's important that you talk with your drug plan to see if you could benefit from this program. And if you do, you enroll in it. And then when you go to the pharmacy, you don't actually pay at the pharmacy. You get a monthly bill from your drug plan. So you pay in monthly installments like a payment plan.
Wow. Is that a new program as well?
Yes, and that is another new program thanks to the prescription drug law.
That's great because now you have the cap on the prescription drugs and you could even spread that out. So it's really a relief for people who are worried not only how they can pay their medications, but how they can pay them over time. I mean, it could be a tremendous expense, and in the past it was. So I'm glad to hear that. Well, let's go to the phones. We're going to head to San Diego and speak to Lori. Lori, welcome to the show. You're on the air. Go ahead with your question, please.
Hi, thank you for taking my call. I'm an ex-nurse, a nurse, and I have some knowledge of insurance. My question is, why do they develop a prescription plan rather than keeping it within the Medicare supplemental plan's responsibility? Because I find it pretty confusing, and I understand insurance to some degree, whereas I think a lot of people are kind of overwhelmed by the different plans, and how they pick them, and I just wonder why they made that change.
Yeah, Lori, thank you so much for asking that question. The prescription drug part of Medicare was created in 2003 by Congress in the law. And so the way that the law is written, you have the prescription drug benefit as a separate part of the Medicare program. That's just the way the law was written. But I agree. I mean, it can be very confusing to navigate health insurance. And we have tried very hard to make it as easy as possible. So, there are, for people who want to go and check about their options, and I highly, highly, highly recommend that everybody does this. There are three main ways. The first is Medicare.gov. Medicare.gov. When you go to the website, you can click on Find Plans Now. You can input your prescription drugs into the website, your pharmacy that you like to go to, and you can get a side-by-side comparison of plans on cost, quality, and coverage to make it easy for you to make a decision. But there are some people who want to talk to someone. So for that, number two, you can call us at 1-800-Medicare. That's 1-800-Medicare. We are available 24 hours a day, 7 days a week to help you one-on-one to be able to think through your options. And then the third way to get help is in-person local support, because some people like a computer, some people like a phone call, other people want to see someone, flesh and blood, in their community. So the State Health Insurance Program, or SHIP, has counselors that can help you one-on-one, personalized support to help you pick the options that work best for you. So you can go to shiphelp.org to find a counselor near you. So 3 ways: Medicare.gov, 1-800-Medicare, and shiphelp.org. These are the official, unbiased sources of information to help you navigate your options. And I say that because I'm sure many of you have gotten lots of marketing and advertisements from health plans during this open enrollment period. We have been cracking down on misleading marketing. In fact, we rejected more than 1,000 TV ads that we thought were misleading. We want to make sure that all of you are getting official, unbiased sources of information so that you can make the best decisions for you.
Meena, that's so clear. And for people, if they want to just go to one site and get all this information, where do they go on the web?
Medicare.gov.
Okay, that's pretty straightforward. Lori, thank you so much for your call. And by the way, once a nurse, always a nurse. And for all of our healthcare practitioners out there, so important that we understand the insurance coverage as well so we can help educate our patients. And Dr. Seshamani, I want to just make clear something that you and I have talked about before, that you don't make the rules. Congress makes the rules. You implement them. And that, you're not a politician, you're a doctor, and you're trying to do everything possible to make this as simple and as effective as possible. Do you want to just say something towards that?
Yeah, sure. I mean, actually, it comes back to Lori's question. Congress writes laws. They're like at the 50,000-foot level, and that's what provides the framework for the Medicare program. Then within that legal framework, we, in the Medicare program, we write regulations, which is at like the 25,000-foot level. So we take the legal authority that Congress gives us and we implement the Medicare program. And then there's a third level to Medicare, which is when all of you get care from a doctor's office, from a pharmacy, from, a home health nurse, from a skilled nursing facility. So it's been very important for us to make sure that all three of those levels are coordinated. Where Congress passes a law, for example, the new prescription drug law that President Biden signed into law, then we implement that, again, giving all of you the $2,000 out-of-pocket cap. And then we work with the drug plans to say, okay, now you have to deliver that $2,000 out-of-pocket cap to people. And we try to help people like you to be able to make sure that you enroll in a plan that provides you the coverage you need and helps save you money.
Well, it's enrollment time, and if you have questions about Medicare, you can't get a better source of information than the Deputy Administrator and Director of the Center for Medicare, Dr. Meena Seshamani. She is on the air with us. She is spending her time, and if you have questions, give us a call. You can speak with Dr. Seshamani directly, online, live at 1-877-NYU-DOCS. That's 1-877-698-3627. I'm Dr. Mark Pochapin, your host, and we'd love to speak to you. Well, let's head now to New Jersey and speak to Janet. Janet, welcome to the show. Go ahead with your question, please.
Yes. Can you hear me?
Yes, perfectly well.
Okay. Overall, do you find that straight traditional Medicare covers more drugs than the Medicare Advantage plans, just generalized?
That's such a great question. It's hard to generalize. It really is individual based on what drugs you take and what drugs you need. And it's really important to look at the plans that you're considering to see if your drug is covered by their formulary. Overall, we have requirements in the Medicare program to make sure that drug plans are covering, the drugs that are needed, meeting clinical guidelines. And we also know that, people's health needs differ day to day. And so that's why it's so important that you make sure that you check to pick the plan that works best for you.
Thank you for the call, Janet. I think a lot of people have that question. It's so important to recognize that a lot of these plans are different. It really is, the details are important, and you have to pay attention. All right, let's head down to Minneapolis, and we're going to speak to Julie. Julie, welcome to the show. Go ahead with your question.
Hi. Thank you. My connection is really scratchy. Can you hear me?
Yeah, we hear you well.
Great. So I just wanted to, I was listening to the show, and expert doctor had said, when you are on Medicare, you can go anywhere. Well, I live in Minneapolis, as I said, and there are several large health corporations here. And I was flabbergasted to find out that I cannot see anybody in those big systems unless my primary doctor is in that system. I even ended up calling Medicare about it because that was my understanding, what your expert just said. You can go anywhere. Not true in Minneapolis. I don't know if that's true in New York or not.
Well, our expert is actually the deputy administrator. She runs Medicare, so she should know. Go ahead, Meena.
Yeah, so I wonder if you might be on a Medicare Advantage plan, because those plans can set those kinds of limitations to, you have to have a primary care doctor refer you to see a specialist. In traditional Medicare, you can go see it has to be a doctor that participates in the Medicare program, but you can see any doctor that participates in the Medicare program. So I wonder if, this may be an example of what we were talking about, that if you have a Medicare Advantage plan, that's run by one of the private plans, sometimes they do have those additional requirements, and they can have additional requirements also, something called prior authorization, where before you get a treatment, they have to approve the treatment. And we've done a lot to try to streamline that. Like if traditional Medicare is covering a treatment, then we say that Medicare Advantage has to cover it. No ifs, ands, or buts. To try to make sure that the private health plans are providing the necessary care to people who enroll in their plans.
Mm-hmm. And Julie, do you know if you have original Medicare or traditional Medicare or a Medicare Advantage plan?
I have traditional. I actually have tried to steer a lot of people away from Medicare or from Advantage plans, because I am a retired nurse and I have seen people have some pretty awful bills. So, no, I have traditional Medicare. That's why I was so surprised.
Well, maybe it's possible that the group doesn't accept Medicare. Not every doctor, although most do. What do you think, Dr. Seshamani?
I think that's something that, if you give us a call, we can definitely, look into your specific situation and see what might be going on.
Mm-hmm. And you had given, again, the three means of reaching. You want to just
go over 1-800-Medicare. That is the phone number to call.
An easy number to remember. Well, Julie, hopefully use the message when you speak to them. Say you spoke with Dr. Seshamani, and Medicare should be accepted by everyone who takes Medicare. But the Medicare Advantage plans, those are the ones that I've seen patients get confused with, because sometimes they think they're getting one thing and they're actually getting something else, and that's why it's really important to look into the details of the Advantage plan. Now, the Advantage plans are Medicare approved, but it's a private company, and to the point that was just made, there may be restrictions on how you see the doctors, whether it needs a pre-approval for referral or something else. So again, so important that you know exactly the type of plan that you're choosing. I want to remind everybody that we're talking to Dr. Seshamani. Meena Seshamani is a physician. She is an ear, nose, and throat physician, but she's also the director of Medicare. And if you have questions about Medicare, it's enrollment season, please give us a call. We're at 1-877-NYU-DOCS. That's 1-877-698-3627. She is spending her time with us to answer your questions. I'm Dr. Mark Pochapin, your host. You're listening to Chiefs Rounds. We're going to have to take a short break, but we're going to come back. So just think about those questions that you need to answer, and you have the expert, the greatest expert you can imagine, who's going to be with us for the next half an hour. So don't go away.
Never miss a beat of Dr. Radio with the SiriusXM app.
Dr. Radio.
Simply download it and take our medical experts with you everywhere. Just search Dr. Radio.
Will you still need me? Will you still feed me when I'm 64?
That's a great way to come back. We're talking about Medicare. I love our producers. I love our engineers here at SiriusXM Dr. Radio. They always keep us on our toes, but we're talking about Medicare on Chiefs Rounds. I'm Dr. Mark Pochapin, your host. I'm the Division Director of Gastroenterology and Hepatology, Vice Chair of Clinical Affairs for the Department of Medicine, right here at NYU Langone Health, broadcasting live from Manhattan. And I have such a special guest who I just love speaking to, Dr. Meena Seshamani. She is the Deputy Administrator and Director of the Center for Medicare. She is the top person in Medicare, and it is open enrollment season, and a lot of you have questions about Medicare, Medicare plans, the differences, and how you can get the most. We also heard about the incredible news about the prescription plan coming into effect, where there'll be a cap of $2,000 and how you could even spread out the cost of prescription plans over the course of the year. Dr. Seshamani is here to answer your questions. And she has a background not only in running Medicare, but she's an expert in healthcare. She's an economist. She has both an MD and a PhD. She served as Vice President of Clinical Care Transformation at MedStar Health. She also practiced as a head and neck surgeon at Kaiser Permanente. And I have to say, she sounds like a doctor and not an administrator, and certainly not a politician. And again, if you have questions, give us a call, 1-877-NYU-DOCS. That's 1-877-698-3627. We'd love to answer your questions. We are here for you. Meena, before we get started with the calls again, I just want to bring up something that has been really disturbing, is all the fraud that we've been hearing about, the scams. Mm-hmm. And, you know, it's just so awful that people prey on older adults who are thinking they're getting something special and end up finding out that this is a fraud type of insurance. How can people protect themselves from that?
I'm so glad you asked, Mark. So the key thing to remember is that Medicare will never call you. If you get a call from someone saying that they are with Medicare and asking for your Medicare number or asking for your Social Security number, hang up, because Medicare will never call you and ask for your personal numbers. That is probably someone who's trying to get your number so that they can then, scam you or scam the Medicare program. And really I think the other important thing to remember is that especially during open enrollment, there are lots of ads. You're probably getting mailers, there are television ads, there are radio ads. Those are ads from specific private health plans that are providing Medicare services. That is not the entire Medicare program. So they are only going to be selling you specific products. So if you want official, unbiased information, there are 3 ways to get it. First, by going to medicare.gov, our website. Second, by calling us at 1-800-MEDICARE. We're available 24/7. And third, by finding a state health insurance program counselor locally in person near you at shiphelp.org. Those are the 3 official sources of information for the Medicare program. So that way you can get the information that you need to pick the option that works best for you, and so that you don't get misled.
Thank you, Meena. I'd also say that Dr. Radio has its own insurance program called Healthcare Connect. It's every Thursday from noon to 2 p.m. We had it earlier today, and I think it's another wonderful resource for all of you to get yourself the information so that you can make decisions about your insurance. And when it comes to the enrollment time, you're ready to make choices based on information that you're in control of, not allowing others to try and sell you on something, because sometimes you sign up for something that you find out wasn't exactly what you thought it was. And to your point before about fraud, if Medicare is calling you, hang up, because Medicare is not going to call you. And I think that is such a simple rule to have for anybody listening. If anybody ever asks for your Social Security number or telling you they're calling on behalf of Medicare and asking for that number, it's a fraud. So just hang up. Well, let's head back to the phones. Again, if you have questions about Medicare, we have the Deputy Director right here on the phone with us. She's taking her time to answer your questions at 1-877-NYU-DOCS. That's 1-877-698-3627. Let's head to our own state of New York and speak to Regina. Regina, welcome to the show. And what questions do you have for us?
Hi, thank you. So I'm a little bit familiar with Medicare and all its components. I thought I knew what an Advantage plan was. I'm being told that it's different than a supplemental plan. Is that true?
That's a great question, Regina. So yes, supplemental plans are different. So if you have traditional Medicare, most people get a supplemental plan alongside their traditional Medicare to provide some additional benefits, like maybe there's some dental, some hearing coverage. It also then provides a limit to your out-of-pocket costs. So the traditional Medicare goes with a supplemental plan, also called Medigap. Or you can do Medicare Advantage. So it's like traditional Medicare plus supplemental or Medicare Advantage.
Regina, does that answer the question?
Yes, just one more question that goes from there. So if I choose an Advantage plan, may have its own drug plan, but a Medigap would not, correct?
Correct. Actually, this comes back to a question that another listener had asked. The supplemental plan doesn't have the drug in it. You have to purchase a drug plan. Right. So a lot of times on the Medicare Advantage side, the same health plan will also offer the drug plan together. Okay. On traditional Medicare, you have to get the drug plan. And again, on Medicare.gov or by calling us at 1-800-Medicare, we can help you figure out what plan best meets your needs based on the prescription drugs that you take.
Is that clear, Regina?
Yes. Last question real quick. I'm sorry. So Medicare.gov, will I be able to look up Medigap plans? Yes, right?
You can look up some Medigap plans on Medicare.gov, and it will also give you additional information if you need to, look further, because Medigap plans ultimately are done by the states. So you can find the information that you need on Medicare.gov.
Wonderful. Thank you so much. Have a great night.
Absolutely.
Thank you, Regina. All right, we're going to head to Boston, Massachusetts, and speak to Joanne. Joanne, welcome to the show.
Hi, thank you. I have a question. I am still employed. My husband is on Social Security, Medicare. He signed up for Medicare, but I have group insurance. So they're going back and forth as to who's primary, who isn't. And how do you get Medicare to pay? Because I'm stuck in the middle and no one's paying these bills.
Yeah, I think for that, I'm really sorry to hear that there's an issue of who is the primary payer and who is the secondary payer. I would definitely suggest calling us so that we can, help get that sorted out. Usually, if you do have insurance through your employer, then the employer is the primary payer and Medicare is secondary, but we can definitely work that through.
Joanne, it's 1-800-Medicare. It's actually a very easy phone number to remember, and there are people there all the time who are waiting to help. You could also get information on the website, Medicare.gov, and I think we don't recognize that there are people there to help us. And these things are confusing. And Meena, I could tell you, not being on Medicare yet myself, but coming to a theater near you, I get these questions all the time from my patients. And it is confusing. And a lot of doctors don't have the answers, don't know how to actually answer these questions. And sometimes we get into trouble. We might make a recommendation that might not be appropriate for the patient. So I think this is a place where people listening, particularly on this station, people listening tend to take ownership of their health. But when you have questions, call. I mean, that's what these folks are here for. That's why Dr. Seshamani, she runs Medicare, but she's here answering your questions because they want to get that information out to you. There are some benefits that people don't even know about. And I think it's probably worth mentioning again, the new drug prescription benefits, Dr. Seshamani, just because I think it's such a benefit to Medicare patients and also to recognize that this is something good that's happening. This is good news when we're kind of in the throes of just a lot of, a lot of bad news coming our way. And at multiple levels, people are, not exposed to things that are helping them. And I think Medicare and this prescription plan can. So let's talk a little bit about that again. What's new about it?
Yeah, absolutely. So with the prescription drug law that passed, there are several really important improvements to the Medicare program. Already in place, people who take insulin do not have to pay more than $35 for a month's supply of a covered insulin on their drug plan. That is huge. I mean, I've talked to seniors who were spending $400 a month on their insulin. Now, no more than $35 per month per insulin that's covered. Second, recommended vaccines are available at no cost to you. So now is the time to get your RSV, flu, COVID, shingles, all of the Tdap. I mean, all the recommended vaccines are available at no cost to you. Third, starting this January, there will be a $2,000 out-of-pocket cap on your prescription drug costs out of pocket. So that means in the calendar year, you will not pay more than $2,000. And it's the first time in the history of the Medicare program that we have had a limit to what someone can pay out of pocket for their prescription drugs. Again, I've talked to seniors across the country. There was one woman who was spending $17,000 out of her own pocket for prescription drug costs. And now she and her husband are hoping, with the savings that they're going to have, they're hoping to finally take a trip to visit family. And they weren't able to do that before because all the money was going towards the drug costs.
That is such a great story.
Oh, incredible. In fact, she gave me a hug. She was like, "Thank you for doing this." But this is why it's so important right now during open enrollment for you to go and make sure that your prescription drugs are covered by the drug plan that you want to be enrolled in, because all of these benefits I talked about are only if they're covered by your plan. So it's so important to go to medicare.gov, call us at 1-800-MEDICARE, or find an in-person counselor at shiphelp.org so that you can make sure that you're taking advantage of all of these benefits. Because, open enrollment ends on December 7th. December 7th is the last day of Medicare open enrollment. And if you miss December 7th, then you could have to wait a full year before you can look again and make sure you're enrolled in the plan that works best for you. I know many of us wait till the last minute. I confess that I have a tendency to, not do things right away. It is human nature, but now is the time to go.
All right, December 7th. That is an important deadline.
December 7th. Because now is the time to look, because if you have more questions, you have time to get help in answering them so you can have the confidence that you are making the choice that works best for your health and financial needs. So act now, and definitely act before December 7th.
Really good advice. We're talking to Dr. Meena Seshamani. She's the Deputy Administrator and Director of the Center for Medicare. She is the top person in Medicare. She is here with us today to answer our questions. Tell us about all this good news. Thank you, Meena. Finally, to hear that prescription plans on Medicare have a cap is wonderful. If you have questions about Medicare, we're here to answer those questions. 1-877-NYU-DOCS. That's 1-877-698-3627. Of course, the Medicare number, although it's not live on the radio, is 1-800-MEDICARE. So that's another number for you to know. You could also email us your questions at docs@SiriusXM.com. I'm Dr. Mark Pochapin, your host. We'd love to talk to you. Well, we have a number of calls coming in, so let's head to Connecticut now and speak to Susan. Susan, welcome to the show, and what question do you have for us?
Yes, my husband retires December 4th, so we are both having to go to Medicare December 5th. The problem is I have 4 facial neuralgias and anesthesia dolorosa, and my pain management regimen after 14 years now is gabapentin and Nucynta. But Medicare doesn't cover Nucynta. Is there a way to do an appeal? I have not tried ketamine infusions or methadone, but every other single drug remotely thought to help facial neuralgias I've tried. I also have a peripheral stimulator and a cervical spine stimulator. So I've done the surgeries. I've tried everything, but I can't afford $35,000 a year for Nucynta.
Yeah, Susan, thank you so much for sharing your story and your question. I think that so first, you don't have to wait until December 5th to start the process. When you are newly eligible to Medicare, you can start the enrollment process up to 3 months before eligibility actually kicks in, so that you have time to get some of the questions like what you're asking answered. So I definitely would start working on this right now. And I think calling us at 1-800-MEDICARE would be very helpful to make sure that there isn't a plan that covers, that specific product. And if there is not a plan that covers that specific product, then there are formulary exception processes that you can do, so that, to your point, you can appeal to try to get that covered. And 1-800-MEDICARE can help you, or one of the SHIP counselors can help you. So that's the SHIP, like battleship, SHIP as in Paul, help.org. And you can find someone locally to you who can help you look at the various plan options to make sure, is there any plan that does cover what you need? And if not, then they can also help walk you through being able to get a formulary exception.
Mm-hmm. Susan, does that help answer your question?
Yeah, it does, because we've looked at all of the different plans and they're all saying no. So, okay.
Okay, well, it sounds like you can get some more information and get some people to really help you look to find if a plan can cover that. And we hope you feel better, and glad that you've had success in finding some medications that help. But now, the insurance coverage obviously is so important. So good luck, and I think good advice for people.
And that's where you have the opportunity to appeal and to, try to get it covered if it's not on the formulary. So I definitely encourage you to do that.
That's great, and that's good to know, because a lot of people feel like there's no recourse, but clearly there is. And again, that phone number, 1-800-MEDICARE, is the number to call if you have questions. And this SHIP, SHIP, it sounds like is that a new program, or is that something you've had in a while?
That program has been around. It is a grant-based program through the U.S. Department of Health and Human Services to have local counselors who can help people navigate health insurance.
Mm-hmm. Well, it sounds really important because it is confusing. So it's good to have these resources. Okay, we're going to head now to Illinois and speak to Barb. Barb, welcome to the show.
Thank you. One question, first of all, and that is, if you call the Medicare number, are you on hold for 50 minutes or 3 days? Or how fast will the call be answered?
That's a great question. I will say that we significantly staff up during open enrollment so that we can keep wait times very low, and we are monitoring our wait times as well. So if wait times, you should not be waiting 50 minutes. And if you are, then we need to know, but we are monitoring the wait times to make sure that we are staffing so that people get their questions answered as quickly as possible.
Okay, and my real question is, I've got Humana Part D, and a drug that I've just been put on will cost me $2,000 a month, but through them, I can get it as cheaply as $1,100 a month. Will this new January 1st thing work with my particular Humana plan, or do I have to find a more expensive Humana plan or some other Part D company to actually get this drug covered?
That is a great question. The $2,000 out-of-pocket cap applies to all Medicare prescription drug plans. So it doesn't matter what prescription drug plan you are on, you will have the $2,000 out-of-pocket cap. But that $2,000 out-of-pocket cap is only for drugs that are covered by that prescription drug plan. So it's very important to look and make sure that the drugs that you take are on the formulary of the prescription drug plan that you want to enroll in.
And Dr. Seshamani, if it's not on the plan, is there a resource that you have in Medicare that could help find a plan that might cover that drug?
Yes, so Medicare.gov, you can put in your prescription drugs, and then you can go through and click on various plans, and it'll let you know if it's covered or not. Or you can call us at 1-800-Medicare, and we can help search with you to find a plan that covers your drug. And again, like one of the previous callers, sometimes people are on very specialized medications that may not be covered, on a regular basis. But there you can, as she said, appeal. The technical term is you do a formulary exception process. So you can provide documents to the health plan, to the drug plan, oftentimes with your doctor to say, no, I really need to be on this drug, and you can get an exception for that drug to be covered.
Mm-hmm. Really good to know. Well, Barb, good luck. We hope that your plan does cover, and if not, it sounds like you have a recourse to go through Medicare, see if they can help you. Meena, what if people have trouble paying their health care bills? Is there financial assistance? What can be done? Because, healthcare is so expensive and can be unbearable. It could really break someone's financial account.
Oh, absolutely. And I'm really glad you asked. There are two financial assistance programs that we have in Medicare. And it's not good enough that we just have these financial assistance programs available, right? People need to check and see if they're eligible so that they can enroll in them. So the first is the Medicare Savings Program. That can save you money on your doctor co-pays, your premiums. And so you can call us at 1-800-Medicare. If you are lower income and if you have trouble paying your Medicare costs, give us a ring and we can help you figure out if you could be eligible for financial assistance through the Medicare Savings Program. The second financial assistance program is for prescription drugs. It's called the Extra Help Program. And in fact, the prescription drug law, the one that has brought the $2,000 out-of-pocket cap, the prescription drug law also expanded the financial assistance of Extra Help for prescription drug costs. So if you make less than $23,000 a year or less than $31,000 a year for a married couple, call us, 1-800-Medicare, because you could be eligible for financial assistance for your prescription drugs. So if you have Extra Help, you would only pay $4.50 for a generic prescription fill, and $11.20 for a brand drug prescription fill. So it is significant financial help. So definitely, if you have trouble affording your healthcare costs, give us a call and we can help you figure out if you're eligible for one of these financial assistance programs.
It's really great advice, and I think a lot of people don't recognize that. So it's nice to hear that there is this assistance, because things can be expensive and people could really feel helpless about what they can do about it. So it's good to know that our government has our back with these programs. Now, Meena, more broadly, in terms of your vision for 2025 in the future, what do you view as the top priorities for Medicare? And we only have a few minutes left of the show, but I think it's important to look forward.
Oh, absolutely. My team and I have really, over the past 3.5 years together, tried to make sure that the Medicare program is not just treating your individual diseases, but is caring for you as a person. I think that I'm not alone in saying that I am greater than the sum of my diagnoses. I am a flesh and blood person who wants to be cared for as a person. And a lot of the improvements that we've made to the Medicare program are really to do just that. For example, we now pay for care navigation for people who have serious illness. Because, getting a cancer diagnosis is bad enough. Now you have to navigate your insurance. You have to figure out where to get your blood work done, where you get your imaging done, which doctors are the specialists talking to each other. Now Medicare pays for a care navigator for you. Medicare also now pays for training for family caregivers. If you, like, I'm a surgeon, I would take care of people in the hospital post-op. They have these wounds that need to have dressing and packing, and you're sending them home from the hospital and they have a loved one who's trying to do, the wound care. Now Medicare pays for training for that loved one to be able to care for the person coming home from the hospital. So we've made lots of changes like that to really care for people and care for them in their communities. And I think that is where the program will continue to go.
That's really great. In the last few minutes, any last words you want to tell people? What's the deadline, what they need to do to make sure they get enrolled in Medicare, and who's eligible?
Yes. So now is the time. It is Medicare Open Enrollment. The deadline is December 7th. So look and make sure that you are in the option that works best for you before December 7th, because if you miss the deadline, then you could have to wait another year before seeing if you're in the best option for your health and financial needs. And there are 3 main ways to get help to figure out what works best for you. The first is going to Medicare.gov and clicking on Find Plans Now. The second is calling us at 1-800-MEDICARE. And the third is finding a local in-person counselor to help you. And you can find a counselor at shiphelp.org. That is so important because we've talked this evening about some really exciting improvements to the Medicare program. And so you have to make sure that you are taking advantage of those improvements, because I want to make sure that all of you are able to stay healthy and save some money in the process.
Well, Dr. Seshamani, thank you. On behalf of all of us covered by Medicare, on behalf of all of the new innovation and coverage with the drug plan, with the assistance programs, and the access for information at 1-800-MEDICARE and other programs like SHIP that you mentioned, thank you so much. And thank you for your time. I mean, honestly, to have the Deputy Administrator, the Director of the Center for Medicare, on the air with us to answer questions from our callers is really special, and it shows how important really the American public is to you, Dr. Seshamani. So thank you so much for your time.
Mark, I was just going to say, it's special for me. Like, this is why I've done the job that I do, right? Because I love to be able to talk to those of you who are, using our program so we can make sure that we are there for you for what you need.
Well, thank you. Well, all of you realize what a special program. And remember, there's nothing more important than your own good health. Bye-bye now.